Hi, I've got a business idea for you. And sadly, I didn't want to mention it in the promo, but I've had this business idea on the list for quite a while. But I had to bring it to the forefront with the onset of Gene Hackman's death because even though his wife had passed a week before him, had someone been there for him, we may still have that very brilliant talent alive to appreciate today. Non-medical healthcare services that you can start right now. Now, I was a consultant for a franchise owner, and so I know firsthand what this business can do. But as an entrepreneur, I have to tell you that enough technology and elements are in place that will allow you to do this business without the franchise, without the royalty fees, without the big buy in. You can do this yourself. Now, I can't wait to tell you about this business. A non medical home healthcare service means you can't administer medication. You're there as a caregiver. You're there to remind them to take their medication. You're there to maybe cook some food, light cleaning if that's part of the contract that you want to do, maybe driving them from appointments or to events or something like that. But it's non-medical home health care service. So there's no licensing or certifications required for you or your staff to perform these services. That makes it a very low entry. Now, the beauty of this is we're at a point where the baby boomers are at the forefront. And as we are aging or as anybody needs help, this is what non medical home health care does. I have a niece that's 39, 40 years old, and she's needed a heart transplant for the last 8 years. And I literally was just on the phone last year trying to find someone where she is in the state that she's in that can provide non medical home health care services. So, hear me out. What this business does is it assesses what the client needs. Usually it works in 4-hour shifts up until 24-hour shifts, depending on what the client needs, and you charge accordingly. The minimal startup, according to my research, was running at about 7,000. Now, I can tell you from the table that you don't have to have an office set up because you and the caregivers are going to be at the client's home on site. You're going to visit the client to assess their needs, to talk to their family members, to make sure that the caregivers are on time and doing what needs to be done. The caregiver is going to be spending the time at the client's location. So, an office is really irrelevant. So, we can take that. What's office space? $1,000 to $3,000 a month. We can take that out of that $7,000 startup right there and almost cut that number in half. And the main things that you're going to need is going to be liability insurance and bonding. And if your state requires a non medical home care license. So that's something you're going to have to look into by state. But that's another number in the $7,000 startup budget that could be eliminated. So now that we've gotten into our lean startup numbers, I want to move over to who you're going to target. In addition to the elderly, which starts at about 65 years old. Those are the ones that need assistance. Those are the ones that need most of the physical help, the mental help, are the elderly. But you also have people, like I discussed, my niece, who is just turned 40 this year, and she just has this disability and she needs medical assistance. So you've got people with disabilities, and there's resources and services and agencies that these people frequent that you can work with in order for them to send you leads. Post-surgery and rehab patients, busy families, veterans, and Medicaid beneficiaries. Now, generally speaking, with this franchise that I worked with, I can tell you for a fact we did not take insurance. All of these clients paid cash. So, for their parents, for their loved ones. So, you don't have to deal with that either. To the rate, that's going to vary. It's going to be negotiable. It's based on how much care you need. But generally, you have an hourly service rate that you charge the client, and you have a live in rate. With these rates, you can seek anywhere from $2,000 a month to $9,000 a month per client. So let's assume that you are a solo provider and you have 3 clients. You can easily do $250,000 as a solo provider. Let's say you hire 5 caregivers, they're working 40 hours a week, and you're billing at $30 an hour. You're looking at a revenue of at least $720,000 a year for you and 5 people that are committed to helping you succeed. Everybody works, everybody gets paid. This is a great, great business idea for you to start. Low startup, strong demand, high income potential, totally scalable, especially if you start working with Medicaid and VA contracts, which we haven't even gotten into. So I did a little reverse engineering because the franchise owner that I did projects for, um, she was at 1.4 million. I know she bought in the franchise in 2012, I believe it was. She brought in the franchise at like 13,000, and then she's paying royalties because it's a franchise, and she wasn't really paying good money for her caregivers, even though she was banking 1.4 million. So I did some reverse calculations here, and that 1.4 million, and she had 140 caregivers, is about 10,000 per caregiver. I raised that to $20 an hour per caregiver. Um, and you can certainly exceed that $1.4 million a year because I've seen it done, especially if you're in a big city. For 50 caregivers, you could do the million, you could hit the million for certain. So if you could hit the million at 50 caregivers, multiply that by 3 for 140, 150 caregivers, you could easily do $3 million. Does this sound like the perfect business idea for you to start? Well, you've got 3 options. If this video gave you everything you need, you're ready to go for it. Get started and make it happen. If you think that you have a few more questions and you want to have a real discussion, get some specific questions answered, join Hub 6. Inside Hub 6, in the comments, type "Let's Talk." We'll set up a live Q&A where you can get your questions answered and really confirm that, yeah, this is the business that you want to start. Now, you want to get in that fast start lane, grab the Fast Start Toolkit. If this is a brand new business idea at the point of you seeing this video, the Fast Start Toolkit may not be on the website. If it's not on the website, in Hub 6, in the comments, type Fast Start Toolkit. That will prompt us to create the Fast Start Toolkit for anyone that wants to purchase this business ideas Fast Start Toolkit. Inside the Fast Start Toolkit, you'll get a complete marketing playbook, how to find your customers, how to create a marketing strategy, funnels, how to get leads, how to price your products, additional services to offer, how to scale this business and go national. That's the bonus content. So you're going to use this Fast Start Toolkit over a long period of time because as your business builds momentum, you're going to be able to refer back to this Fast Start Toolkit and say, okay, now I'm ready to grow, ready to expand, to scale. But here's where it gets even better. You know this is a business for you. You're a member of Hub 6 and you're downloading the Fast Start Toolkit. Because you're part of the No Boss family, I'm automatically going to give you a month free in the hub of your choice. Let's say you're starting to work on this business idea, but you need a little help with planning, licensing, launching the business name. That's what's going on in Hub 1. Let's say you can do that on your own, but you do need help with marketing, strategies, funnels, launching. Well, use that free month to jump into Hub 2. But what if you don't know how to use the tools? You don't know how to create content? Well, use your free month to jump into Hub 3. The bottom line is you've got everything here you could possibly need. So start by joining Hub 6 and let's get your business idea off the ground right now. See you in the next brilliant business idea.